Hey everyone, how are you doing today? We're back and I'm excited to be back on our next live airing of Dr. Sumner's Summit to Wellness. We're here live on both Facebook and Instagram, so join me tonight. We had a great discussion, some very interesting information, so invite your friends, your loved ones, those who you think benefit from it. Hi, Simone. Thanks so much for joining. So I'm Dr. Sumner, your board-certified family medicine physician and wellness strategist, and I am dedicated to empowering you and your communities to become well, whole, energized, and loving life. Thanks so much for joining us today. So excited to have you guys here. And I currently do this through speaking engagements, telemedicine services, and online coaching services. I also need to just remind you briefly of a disclaimer that as much as I truly enjoy helping to inform you about topics related to your health and wellness, this is not medical advice. This is for informational purposes only. So if you have any specific questions related to your individual diagnosis or treatment plan, then please discuss them with your doctor. And if I am not your doctor and you'd like me to be, then please visit drfsumner.com. Dr. F is Felicia, Sumner.com, or message me. I'd be happy to get you set up for an appointment. I currently see patients in the states of Georgia and Pennsylvania online. It would be my pleasure to see you. Okay, so now that housekeeping, as usual, is out of the way, let's get to it. I took a poll in our Facebook group on the subject you guys would like to hear about as we discuss subjects beneficial to American Heart Month, which is February. And the topic chosen was, how does the bacteria in your gut affect your heart health? So I'd like to provide you with some helpful information that you can apply to your current nutrition plan starting today, starting tomorrow. But I've got to let you know the research is still changing every day. Not everything is set in stone, but I've tried my best to package this information in a way that's useful for you. Okay? So let me also warn you that for anyone who gets squeamish about poop talk or about bacteria type things, then this might not be the talk for you. This might not be super enjoyable for you. But if you don't mind poop talk, then let's get into it. So, all right, this session we're going to be talking about what is the gut microbiome. Have you heard that term before? Gut microbiome. Let me know. We're also going to talk about what does the gut microbiome do for you and your heart health. And then we'll chat about a compound that ties in your gut health to your heart health. But still, only one of many things that tie the two, your gut and your heart. And then we'll discuss how we can fix our gut microbiome, our gut health, to improve our heart health and potentially decrease our risk of heart disease. Okay, so thanks so much for joining. And again, if you have any friends or family that you think are suffering from heart disease or could be at risk or just would benefit from this information overall, please tag them, share this with them. And I want to share beneficial information that's going to get you guys, including myself, well, whole, energized, and loving life. So let's first start with the understanding of this term called the microbiome. What is the microbiome? Have you heard that term before? Let me know, because I'm sure it's not a common term. I know it, but I've been indoctrinated with a lot of information throughout medical school and residency and beyond. So basically, we all have trillions of bacteria that live in our intestines. And that's what we call the gut microbiome. This is crazy to think about, but we eat pounds worth of bacteria, viruses, and yeast every day. A good amount of the calories we eat, they don't get absorbed or used directly though. So the gut microbes, or the bugs in our gut, will actually use the food that we can't absorb as nutrients and then generate waste products that can then get absorbed or taken into our bloodstream. And these waste products actually play a huge role in our health, sometimes positively and unfortunately sometimes negatively, and can cause things like diabetes or contribute to diabetes, hypertension, and even obesity and beyond. So your gut microbiome is unique to you. It's actually like a fingerprint, and it represents a combination of lifestyle factors, your genetics, your environment, your food, and even more. Your gut microbiome, which is basically the makeup of the type of bacteria in your gut, it influences your immune response and your nervous system functioning, and it plays a role in the development of a number of diseases, including obesity, cancer, and heart disease. So different from the common saying, it's not what happens in the gut stays in the gut. What happens in the gut definitely affects a lot more than your gut. And this also explains how two people can eat the same exact diet, and that diet can have different effects. Two people can eat the same diet, and one is healthy, but the other person will develop insulin resistance. This is highly affected by the kind of bugs in your gut. The bugs inside of us have evolved over the past thousands of years. Our gut bacteria has been changing as our environment, our foods we grow, and foods we eat have changed. We've also been using more antibiotics, which is like a nuclear bomb to your gut microbiome. It all gets replaced after antibiotics, and it often doesn't come back basically ever the same way that it started. So we actually do need bugs in our gut. They play a vital role in our health. For example, vitamin K, it requires the gut bugs, the gut microbes to make it. And our gut bacteria also secretes vitamin B12. And that's just two of a lot of examples of why our gut bacteria are good for us. We actually have 10 times more bacterial cells in us than our own cells, and 100 times more bacterial DNA than our own DNA. So many of our breakdown products in our blood aren't even human. They're microbial. They stem from bacteria. And a lot of the compounds in our blood are made by bacteria. So there was even a study showing that you could switch the gut bacteria through a fecal transplant, like take the poop, from a fat mouse and put it into a thin mouse, and then that thin mouse gains weight a lot faster and is at increased risk for atherosclerosis, hardening of the arteries, and more clotting. So it's not just calories in, calories out. You don't absorb all the calories of the food you eat. And your efficiency to break down those calories is actually really impacted by your gut microbes, your gut bacteria. And studies show that your ability to metabolize or break down food is influenced by your gut bacteria. Give me a guess, like if you ate a decent meal, how many calories do you think a day could a change in your gut bacteria make a difference? Do you think maybe like 10 calories, 100 calories, 1,000 calories, 2 calories? If you had bad bacteria versus good bacteria, take a guess. How many calories do you think that might influence a day? I'd love to hear what you might think. Because the studies actually show, let me see if there's any guesses yet. Okay, the studies actually show that your gut bacteria is influenced so much that it can change the efficiency of how many calories you break down by at least 30 to 50 calories a day. And it might not seem like a lot at first, but if you add that up over time, it can make a huge difference. That's over 10,000 calories a year if you don't have the right good bacteria in your gut, or you've got bad bacteria in your gut. That can change the amount of calories you're able to burn by at least 10,000 calories a year. So eating processed foods, less fiber, taking antibiotics, being a C-section baby, taking acid blockers, anti-inflammatories, all of those things can lead to a shift of your gut microbiome in a negative way, unfortunately. Simone thought 100. Yeah, so it's thankfully it's not quite that much, but I mean 30 to 50 a day, I mean, I think is a pretty significant deal. That's like at least, you know, a cup worth of berries, or more than a slice or two of bread, things like that. So, all right, so I'm about to get a little nerdy, guys, and scientific with the terminology here, but I ask that you try to stay with me. I'm going to try to break it down as simply as I can. So there was a study done regarding a compound called TMAO. Someone put that in the comments for me. TMAO, also known as trimethylamine N-oxide. So we'll leave it simple and call it TMAO. Okay? These compounds, they strongly predict a person's risk of heart attack and can only be made by bacteria. Our body by itself can't make it. And TMAO is produced by bacteria when exposed to only two different compounds. One is called choline, and the other is called carnitine. Have any of you guys heard of that comment before? Hi, Dr. Kim. Thanks for joining. Thanks for putting them in the comments, Simone. So carnitine especially is typically high in animal products. And carnitine is exclusively found in red meat. That's where we hear the term like carne, I think is Spanish for fish, or carnivore, meat eater. And that's where those terms come from. As for choline, it's in all of us. We all make choline in ourselves. It's even found in our bile. Even if you eat a cucumber, we still make choline. So even if you're a vegan or a vegetarian, you're constantly feeding your gut choline, which will be made into TMAO by some of your gut bacteria. So both of these compounds, choline and carnitine, they're actually beneficial for us a lot of the time. Choline, for example, it helps we use it to build a healthy nervous system, helps with building good neurotransmitters, it helps with muscle movement and healthy liver function. And carnitine, especially a type of this compound called L-acetylcarnitine, it's well known to help your brain perform better, burn fat more, build muscle. In fact, a lot of athletes actually supplement with L-acetylcarnitine. So these compounds, though, when we eat foods that are high in it, they will be broken down by certain gut in your bacteria to eventually become another compound called TMAO. And from what we found, TMAO can highly increase your risk of heart disease if it's above a certain level. So there's a normal amount of TMAO found in everyone, but for people who eat a lot of red meat in their diet, there's much more higher levels of TMAO coming from the intake of carnitine. Thanks so much. Simone said she's never heard of it, TMAO. So great. This is new information for you. Hopefully you benefit from it by the end. So interestingly, thanks so much for joining, Dr. Major. Hi, Nina. Hi, Jarrett. Thanks for joining. So interestingly, studies show that people with diets high in L-carnitine, for example, meat eaters, they have gut bacteria that's more prone to forming TMAO, while vegetarians and vegans did not. For example, in a study, even after consuming large amounts of L-carnitine in a steak or a supplement, the vegetarians and the vegan in the study didn't produce significant amounts of TMAO. So they're typically vegetarian or vegan. They took a whole lot of steak or a whole lot of supplements with carnitine, and somehow they still did not produce a whole bunch of this compound called TMAO, which can greatly increase your risk of heart disease. But it's really, guys, it's unfortunately not just as simple as me telling you be a vegan or become a vegetarian, because this was weird, right? Crazy enough, the highest levels of TMAO they found in this major study was in a vegan woman. They actually figured out eventually, though, that it was because she did a bowel cleanse with a lecithin or a soy-based enema every week. And soy is a large source of choline as well, which is that other compound that can be turned into TMAO. So in essence, the gut microbes, they don't care about where or how the choline or the carnitine comes from. They just care that it's choline or carnitine. They try to eat it up, and it becomes TMAO. So Dr. Artemis says, hi, thanks. Dr. Kim says, this is great info. She didn't know it either. Well, great. I'm so glad to hear this is new info for you. I'm trying my best to keep well read and pass on as much helpful info as possible. So in general, though, TMAO, this is what it does. This is why it's not so great for heart disease. It increases the stickiness of your platelets, making blood more likely to clot. And it's involved in two major pathways. Number one, it makes the cholesterol more damaging, and it blocks the pathway that allows the cholesterol to move out of your arteries, out of your blood vessels. And number two, it interacts with the platelets directly, and platelets are the cells that allow your blood to clot, so it makes blood more prone to clot. So the higher your TMAO levels become, the more fatty plaques may collect in your arteries, which may promote atherosclerosis, the hardening of the arteries, and other heart problems. So I don't want to get too complicated here, but just so this can hopefully get home for you. Hi, Alicia, thanks so much for joining. But so you understand it a little bit more, I have this diagram here. Hopefully you can see it. TMAO, so it comes from eating certain foods really high in protein, like carnitine, like steak, okay, or red meat, or even energy drinks are often high in choline. I had picked up a 5-hour energy actually a couple of days ago, and I saw that it had choline in it. So energy drinks, or even some plants, of course, they have choline. So they get broken down when you eat foods high in red meat, some plants, vegetables, energy drinks, protein shakes, they break down into carnitine or choline. I just have carnitine here for an example. Then your bacteria in your gut, what we call the gut microbiome, it also breaks down the choline or the carnitine into TMA, also known as trimethylamine, TMA. Okay, and then that TMA, it gets converted to TMAO, trimethylamine N-oxide. That's why we call it TMAO, guys. By your liver, but actually also it gets converted by belly fat. So the more visceral or belly fat you have, the more likely you are to convert this TMA substance into the more toxic substance, TMAO. And actually, believe it or not, you can actually measure your TMAO level. It's available broadly across the country as a blood test. Measuring that level may actually help you and your doctor figure out if your diet really is too high in red meat or other carnitine or choline containing products. So you can actually measure your TMAO level. Hi, Abby, thanks so much for joining. Hi, FitMD, thanks so much for joining. So there's actually a cardiologist working on a drug as we speak to block the conversion to this TMAO product and then hopefully stop developing heart disease. That's still in the works though, but we also have no idea as of yet what the side effects of that medication may be. So let's continue to keep an eye on that progress. All right, so to recap so far, we talked about what is your gut microbiome. It's your unique fingerprint of the type of bacteria you have in your gut. And you need bacteria in your gut, ideally mostly good bacteria, to make products to keep you healthy, like vitamins K and vitamins B12. However, some bacteria, they don't do so well for you, and they could make waste products that may harm you. And one example of this we're discussing today is TMAO, trimethylamine N-oxide. That's why we call it TMAO, guys. It's just way too complicated of a word. Whenever you ingest foods high in the compounds choline, which is found in egg products, in liver, in mushrooms and shellfish, and a few others. We talked about energy drinks, protein shakes are high in choline, or foods that are high in carnitine, which is especially red meat, and also in some energy drinks and protein shakes. Depending on the type of gut microbiome you have, you could potentially convert these very healthy and good for you compounds, choline and carnitine. They are good for you in most cases, but depending on your gut microbiome, you could convert them into a waste product due to the wrong kind of gut bacteria inside of you. And that waste product called TMAO is then converted to, that waste product called TMA is then converted into TMAO by your liver or sometimes your belly fat. And that can lead to stickier blood and more cholesterol plaques building in your artery walls if you have too much of it. So does that make sense? Am I like having people spinning? I tried my best to break down a rather complicated scientific physiologic process into easy to swallow terms. So let me know, does that make sense? Did I lose anybody? So again, let me just drive this home one more time. You can ingest foods that are high in carnitine or choline, usually products like eggs, mushrooms, shellfish, egg yolks specifically, things like that. Energy drinks, they're high in choline, or things that are high in carnitine like protein shakes, red meat. They will be ingested, and your gut microbiome, the type of bacteria in your gut, will then turn it into a waste product called trimethylamine, TMA. Then your liver or sometimes your belly fat will then convert TMA into this compound called TMAO, which in some cases is helpful. You should have a certain level in your body, but if it hits above a certain threshold, that's when it can become dangerous. It will develop your blood to become stickier. It'll help build more plaques into your artery walls and increase your risk of heart disease. And that is all dependent on what kind of bacteria you have in your gut. So the main question, I'm sure after you hear all of this, is does all of this mean that you should avoid all meat? And I believe that the answer is a resounding no. The science is very clear that L-carnitine is required to bring important fatty acids to the mitochondria and to burn them as fuel. It's a very important nutrient. Some people who don't eat meat even take an L-carnitine supplement. Personally, I eat red meat like 2 to 3 times a month. I do believe that healthy non-CAFO, probably you may never have heard this term before. It's semi-new to me as well, so don't be embarrassed. But CAFO is a type of meat that we define as confined animal feeding operations. That's why you might hear like, oh, eat grass-fed meat, eat free-range meat, free-range eggs. That's the opposite of CAFO, confined animal feeding operations. So I do believe that healthy non-CAFO red meat can be an important part of the healthy diet. You just don't have to consume it in the excess that almost everyone in the United States does outside of vegans and vegetarians. So anything over 3 to 4 ounces and anything over 2 ounces for people under 150 pounds per week is way too much. So excessive meat, especially CAFO meat, confined meat, will not only contribute to heart disease, but cancer, obesity, diabetes, and even neurologic diseases like Alzheimer's. So does that make sense to you guys so far? Let me know. Alicia said, what's a good way to balance? How do you know that you have consumed too much? So I think I just answered that question. No more than 3 to 4 ounces of red meat a week. No more than. And if you're 140 pounds or less, no more than 2 ounces a week of red meat. I eat personally a little less than that because honestly, there are very few vegans or vegetarians out there with heart disease, but they do unfortunately suffer from some nutrient deficiencies. And some studies show that vegan and vegetarian children also will suffer from some nutrient deficiencies. So personally, I try to find a really good balance. The thing is, we have to choose something to eat. We can't starve ourselves to death and be healthy. So here are my main recommendations considering these findings about TMAO and its relation to heart health, especially if you're concerned for your risk of heart disease, okay, based off of if you have hypertension, if you have diabetes, if you have high cholesterol, if you've got a family history of heart disease. These are definitely things that you'd want to adhere to. So number one, decrease the red meat in your diet, because some people, they eat red meat every day. Are you one of those people? I hope not. Let me know, okay? Alicia says, I don't eat red meat or pork. You mentioned vegetables. Yes, some vegetables are higher in choline. That is why I would suggest, Alicia, if you're really concerned, if you might have high levels of TMAO, get it checked in your blood. You can get it checked with routine blood work, okay? So number one, decrease your intake of red meat if you're a red meat eater. So as I said earlier, 2 to 4 ounces of red meat per week should really be your max. Number two, increase your vegetable or plant component, because most plants, the studies, as I mentioned earlier, Alicia, there are actually, most vegans and vegetarians, even when they eat foods high in carnitine, they don't even end up making significant amounts of TMAO. So if you increase your vegetable or your plant component, that usually will help tremendously. So far, a Mediterranean diet has the best studied outcomes when it comes to heart disease, but there may be a diet out there that's better for your heart that hasn't really been studied efficiently yet. Number three, consider monitoring your TMAO level routinely to see how much red meat and other foods your body, your gut microbiome can even tolerate. You can actually ask to have these levels checked by your doctor. Most routine labs like Quest and LabCorp, they have the ability to check them. And if you have diabetes, if you have hypertension, if you have metabolic syndrome, high cholesterol, heart disease, these tests are usually covered by most major insurances, okay? Number four, cut out the supplements that might have things that raise TMAO, like a lot of energy drinks and some protein shakes have carnitine, choline, or lecithin in it. So you can check that out on the nutrient facts and the ingredients list of whatever energy drinks or protein supplements you're taking. Okay, so overall, eating plant-related products is usually the healthier choice when it comes to heart disease, but diet is a personal choice, and if you're not interested in becoming a vegetarian, I would suggest start with 1 day a week, okay? I think that's swallowable. 1 day a week, you'll have a plant-based diet. 1 day a week, you'll avoid meat, and it may make a significant difference for you. Personally, I'm not a vegan or even a vegetarian. I like my meat, and I believe actually that my healthy ancestors, they enjoyed meat on occasion too. So, but I know that they also ate a diet quite rich in plants and vegetables. So I strive to have no more than 25% of my diet be meat, including red meats. So at least 50% of my plate is usually fruits or veggies, okay? And also, as you change your exercise pattern, your gut motility and your gut microbiome, it changes. So working on a routine exercise regimen is important for your health as well. And trying to get in moderately vigorous exercise for at least 150 minutes per week, which is like an average of 30 minutes Monday through Friday per day, that would be very helpful overall, including to improving your gut bacteria. Okay, so in addition to that, there are some things that you can do to nourish your microbiome, to hopefully make it healthier so that it's not doing the wrong things and it's doing most of the right things. So your microbiome, it's vulnerable to your diet and your lifestyle, and it can be harmed by antibiotics unless absolutely necessary. And as I said before, antibiotics, they could be like a nuclear bomb for your gut bacteria. So when you do need to take antibiotics, try to at least make sure that you're reseeding your gut with fermented foods like kimchi or sauerkraut, or even a probiotic supplement. And other things that could be harmful to your gut microbiome are CAFO, confined animal feeding operation meats. So unless your meat is organic, free range, grass-fed meat, then it's likely fed with low-dose antibiotics and genetically engineered grains, which can also destroy your own gut microbiome. And not just the animal you're eating. So processed foods, they can also greatly destroy your gut microbiome. Things like cakes, cookies, breakfast, cereals, canned vegetables, basically anything that, this is usually my rule, anything that can stay in the middle of the supermarket aisles, those aisles are named or lettered, and they're not the foods that are not along the perimeter. They tend to be processed foods. So try your best to shop along the perimeter of the grocery store, and that usually will keep things safe for you. And in addition to avoiding the things I just named, reseeding your gut with beneficial bacteria is very helpful in order to maintain proper balance, achieve optimal physical and mental health. So you can do this with fermented foods, like I said, things like sauerkraut, kimchi, yogurt, kombucha. You can even ferment a lot of vegetables on your own at home. Just look it up online. It's not that difficult to do, which is pretty cool. Like cabbage, cucumbers, carrots, squash, you can ferment that at home on your own. I would try my best to feed good bacteria through food, but if you can't eat fermented foods, you could consider taking a probiotic, although I personally believe that the majority of your nutrients need to come from food. And if you're going to take a probiotic, you should look for at least 25 to 50 billion live CFUs, colony-forming units, 25 to 50 billion live CFUs from a variety of strains. So it shouldn't just say lactobacillus or like 2 or 3 other things. Hi, Ebony. Hi, Anna. Thanks for joining. It should have a good amount of strains on it, at least 5 strains or so. And if you take a probiotic, you should start slowly. Observe how the probiotics affect your gut. Have any of you taken probiotics before? Let me know. Throw a hand up. Say yep. Because people react differently to it. Nina says, what about the different levels of done, such as rare, medium, well, etc.? How does this play in the bacteria buildup? Good question, Nina. So this is interesting. The studies still don't conclude totally, but you might find this crazy, but studies so far have said that the rawer meat that you eat, the more raw your meat is, but it has to be high quality, like organic, grass-fed, free-range meat. The more raw it is, the lower your risk of heart disease. That's the correlation that a major study found. And when you possibly connect it to gut microbiome, that makes some sense. It's possible that it helps to feed your gut with healthy bacteria, which may make a difference. So I know personally, black folk, at least me, I don't really enjoy seeing pink, let alone red in my meat, but everyone's different. But I'm just going to quote the studies to you. The more raw meat that was ingested in a major study that came out with heart disease and relation, they found a correlation to lower risk or chances of heart disease. Nia said probiotics only yogurt. Okay, I'm not exactly sure what if that's a question, let me know. So when you first, oh yes, so you said, yeah, probiotics, you've only taken yogurt. Okay, so that's a good example. Anyone else take probiotic supplements? Because I found that when you first start taking probiotics, some people might notice some uncomfortable symptoms like gas and bloating, and that's normal. But if those symptoms last for more than a few days, like more than 3 or 4 days, then you may need to delay your probiotics until your gut is more intact. For example, if you're dealing with something called small intestinal bacterial overgrowth, SIBO or SIBO. Have any of you heard of that term before? Ebony says she takes probiotics periodically. Ebony says she eats her steaks or red meat medium well. Okay, fair enough. That's what I've gotten to. That's as far as I'm getting with the rarity of my meat. But yeah, if you are taking anything probiotics, any kind of fermented foods, and you get gassy or bloated, and you have a hard time ingesting it, you could actually be dealing with something called SIBO, small intestinal bacterial overgrowth, SIBO, okay? And you might not be able to tolerate probiotics until your gut is in a better place. So if you think you may have SIBO, then please consult your doctor who can help you figure this out. I see patients through telemedicine online in the states of Georgia and Pennsylvania, and I'll run the appropriate tests if you're concerned. And your doctor should be able to, if it's not familiar to them, then message me and I'll see how I can help. Alicia said, yes, she takes probiotics. It's best to start out every other day. Yes, certainly if you feel that your gut is not tolerating it because you're introducing a lot of new bacteria, then start out slow and work your way up and see how you do there. All right, so we discussed a lot today, but I do hope this information was helpful for you. Was it helpful? Let me know, please. And if it was new, if it was helpful information for you, please, please, please share the information with others, because my mission is to get my patients and their communities to be well, whole, energized, and loving life. And really, a lot of that wholeness, a lot of that wellness, it stems from the foods or the poisons that we put into our body. Because food can be medicine or poison. And I'm not a nutritionist. I'm not claiming to be, nor do I have any intentions of being one. The schooling to become a doctor was more than enough for me, but I do care a lot about my patients. And while I'm on a mission to get myself, my loved ones, my patients, my communities better and more well, I've so far found that our nutritional status, our ability to self-care, love ourselves, is a huge part of that journey to wellness. Elisa said, great info. Awesome. I'm glad it was helpful for you. So I'm trying my best every week to provide you guys with information that'll help you get there to that place of wellness. So let me know if you have any other topics you really would like to hear about. Next week is our last in our American Heart Month. So is there anything else related to heart health that you guys would like to discuss? Let me know, comment below, message me. And if you'd like to schedule an appointment with me and you're a resident in the states of Georgia or Pennsylvania, then hit me up, message me, or click my book here button on my Facebook page, or visit www.drsumner.com. I'd love to see you. I'd love to help you. And are there any more questions, let me know. Justina, hi, thanks for joining. She said this is very informational and helpful. Awesome. Please share this information so you and your communities can feel better, be well, whole, energized, and loving life, okay? So if there are, thank you, Nina. I'm glad it was helpful. If there are no more questions, I will see you next time. Until then, be well, whole, energized, and loving life. Take care, guys.